Both men and women can experience hair loss as they age. While there's no miracle pill to replace hair, an effective way to get fuller hair and keep it is hair restoration. Dr. Timothy Jochen, a hair restoration surgeon at Desert Regional Medical Center in Palm Springs, discusses hair loss and hair restoration.
At least 50% of men lose their hair, and it's the same amount for women. They just don't lose it to the extent that men do, or in the same patterns. When we have a genetic predisposition for hair loss, it can happen at any time in your life. It's sort of the same with diabetes. Some people don't develop diabetes until later in their life, or, and so it's the same thing with hair loss. Some people get it very early in life, in their 20s, even teens, and then other people it's very much later when they develop hair loss. Usually it's when people start thinning that they come in, particularly younger people, because I have people that come in as early as age 20 to talk about their hair loss. But I also have the other end of the spectrum where people have lost a huge chunk of their hair and they come in to talk about hair restoration. But you have to keep in mind, people don't even notice their hair loss until they've lost at least 50% of their hair. It's a really simple technique. What you do is you harvest a graft of hair, just a small strip of hair from the back of the head, and you close it up, and then you cut it into little pieces of what we call follicular units. Hairs come in 1, 2s, 3s, and 4s. Like out of one hair follicle, you'll either see one hair follicle or one hair shaft, 2 hair shafts, 3 hair shafts, or 4 hair shafts. So we cut them into their units, and then we make little holes, very tiny incisions into the area where we want to place the hair. And then we just gently place them into the little holes that we've made. The hairs that are on the back of the head, the receptors are resistant to the hormone changes that cause your hair to fall out. So when you transplant the hairs from back here to up here, they're the same kind of hair follicle that's resistant to the hormone that makes your hair fall out. A person will show up early in the morning, we'll give them a little bit of Valium to relax. We'll harvest the hair graft, or the donor site. We'll harvest the donor site. We'll then close that up. Then the person will relax in the office, watch TV, read a magazine for approximately 2 to 4 hours, depending on how many hair follicles we're trying to harvest for that session. In that period of time, the patient is just relaxing, and after the hair follicles are cut into the individual units, we start to make the incision sites, the donor sites. That takes approximately half an hour, and then after that we start planting the hair follicles. The planting of the hair follicles will typically take an hour to 2 hours to plant them. So the whole procedure takes typically about 4 hours to do, and it really depends on how many follicles we decide to plant in that day. Typically we'll do anywhere from 1,000 grafts to 2,000 grafts per session. In most patients, if they're thinning or have just localized areas of hair loss, you can get away with just doing one transplant of 2,000 hairs. Now, if they're completely bald, it'll take multiple sessions in order to achieve a uniform pattern of hair. What you do is you go home and you can clean your hair immediately. You just have to be very gentle with it for about 10 days. After that point, you can wash your hair and do whatever you would do normally. It does take 6 months to a year before you start to see the hair regrow. You look like you don't have new hair follicles, but if you actually touch the head, if you go like this, you can actually feel them poking out. So when my patients get frustrated and say after 3 months they don't see any new hair, I say, well, just feel, and when you do this, it feels like a little Brillo pad. So you can actually feel the hair follicles there, and that's reassuring to them. Now that we're chopping them up into just single follicular units, it looks very natural, and it's very hard to tell if a person has had a hair transplant. Typically, we have a 90% take rate of the hairs, so 90% of the follicles that we transplant are going to survive and flourish. So it's a very effective procedure with minimal risks and minimal downtime.